Now children, as opposed to adults, they have a very different concept about death, and mostly their concept of death is not realistic, because their minds did not grow enough cognitively. They are not yet prepared to understand the abstract terms such as death. So many misunderstandings prevail in children's concept about death. So to begin with, we will explore what these concepts of death are in children and also in different age groups, and after that we will see how we can clarify the death concepts in children. After that, we will discuss about the kind of responses a child gives for the loss of a parent, and then we will go on to discussing about the terminally ill child, and finally we will see how to cope with death, training children cope with death. So to begin with, let us see what these concepts of death are in children, and they will be quite different from what adults hold. Let us see first the age group 2 to 4. Now in this age group, the death is seen as reversible. That is, children feel that those who have died will come back alive, and their reactions to grief or the grief response will be in such a manner that for some time they will cry loudly for the asking for the lost one who is deceased, and their grief response will be mostly concentrating around the present. That is, they are still not yet capable to think about the future, so mostly it is present based, and also they feel that they keep on asking about the deceased one, so they keep asking questions about that person. Now going on to the next age group, that is ages 5 to 7, here the concept of death, still the child feels that death is reversible. But however, unlike in the earlier age of 2 to 4 years, here children feel that their thoughts and feelings can have an impact on the death process. For example, they might be holding certain magical views and also fantasies. For example, if suppose a boy comes and plays with the neighbor, and this boy breaks the toy of the neighbor, and the mother or someone beats up the child. So this boy might, in a fit of anger, might wish that the parent is dead. And if suppose after few days the parent actually dies, then this child will begin thinking that his curse has an effect on the death of the neighbor's parent. So such concepts are also present during this age group, and their death or grief response will be in such a manner that here the children will keep on asking many questions because they cannot understand the concept of death. So they keep inquiring many details from whoever is available, and also these children start missing the deceased parent or deceased significant other member. Compared with the earlier age group, these children can verbalize their feelings to a greater extent, and also they experience general distress. Coming to the next age group, that is 5 to 11 years, here the children start to understand that death is reversible or it is irreversible, although they want to still hold on to the belief that death is reversible. So because at this age group they are cognitively more developed, and so they get to understand that death is irreversible. So their grief response will be more like asking more deeper questions about death, and they will also be looking forward to getting detailed answers, because they are cognitively they are well developed at that stage, and they want to really find out about death and the concepts behind death. But however, these children do experience lot of distress and anxiety, and also some of them start not performing well in the school, and some of them will stop playing with children normally. Apart from that, these children of this age group, that is 6 to 11 years, they will be confused because they do not know exactly how to respond when there is a death in the family. For example, they will not know whether they can put on nice clothes during the grief period, or they will be confused whether they can go and play with the neighbors or whether they can enjoy. So, they will be looking forward to the behavior of adults, and they want adults to tell them how exactly to respond when there is such a situation. So, going on to the next stage, that is ages 11 and 18, here these children by this time, that is they are in the adolescent stage, they completely understand that death is irreversible, and also they get to understand the concept of death with much more clarity. And their grief response is almost similar to that of the adults. They become distressed, they become depressed, they also show signs of denial, and also some adolescents also regress. And not only that, they are more willing to talk about their grief to outside members, that is they will not be so much open to the family members, but will be more willing to discuss matters with say friends or some uncles. And here in this age group, as a response to grief, these adolescents will also indulge themselves in risk taking behaviors, for example drugs and addiction and also gambling. So, there is all risk that they will get into such kind of behaviors. Let us see what we can do to clarify the concept of death. We have seen that children do not have a clear concept of death, and many times this misunderstanding can lead to many other disruptive behaviors. So, they might ask questions like, is death like sleeping? So, health professionals who are dealing with death, including psychologists, they recommended that parents or guardians or the other elderly members in the family should give correct responses. So, they identified frequently asked questions by the children, and they have also given a suggestion of the answers, the kind of answers that parents should give to the child in order to clear their concept of death. The first question is death like sleeping? Now, many children ask this because they listen to many stories, say like including the story of Sleeping Beauty, where they get to listen that this princess goes on to sleep for many years. Finally, one day when the prince comes and kisses her, she wakes up. So, they might imagine that death is like that, and finally one day when something happens, the person will come back to life. So, when they ask, is death like sleeping, it is suggested that they explain that death is not like sleeping, and that it is quite different from sleeping, and also a person who has died, there is very less chance or they will not come back. So, this clarifies to the child in a much better manner. Going on to the other questions that children ask, for example, they will ask, why did he die? So, mostly the parents might give some vague answers like the person died because something happened, or the person is a very good person, so that is why God took them, and all those things. It is suggested that the parents, when children ask why did he die, to explain that the body is not able to cope with the disease any longer, but they have to take care to tell the child that it is okay even when they get hurt or when they themselves face an illness, because when parents tell them that when you get disease your body is not able to cope and die, tomorrow when this child has some illness, say had an attack of fever, then the child might have the fear that the child is now going to die. So, the parents have to take care to tell them that this will only happen at ripe old age. So, when the body is becomes really old, and it is only then that the body cannot cope up with any diseases, and it is okay to become get fever and things like that, and it is also okay to get hurt. They will come back to normal again. Other questions will be like, will you die, will I die, and the parents try to avoid this question. So, it is recommended that parents tell them that yes, they will die, but they have to make sure and say that, for example, they can say, see, I am 35 years old now, but I might die only after 80 or 85 years. So, that gives a sort of reassurance to the child that yes, death will happen to the parents, but it is not in the near future. And also similar answers can be given when the child asks, will I die? And other questions like, did I do something bad for this death to happen? Many children, especially in the age groups of say 5 to 9 years, they have several doubts that they did something and that is why God has punished them or whatever, and so the person has died. So, parents have to reassure them that any amount of thoughts or any kind of thoughts or feelings or behavior will not result in death. So, the child needs to be reassured in that manner. They might also ask questions like, will that person come back? Although forever is a difficult concept for children to understand, but parents have to make sure that the person will not come back, and they should not give hopes to this boy or to the girl that one day they will return. Going on to other questions like, is she cold, or how is he going to live without eating? See, for example, when a burial takes place, the children are taken to the burial ground where they have ceremony, and they see that the dead body is buried under the ground. So, many children will wonder how they are going to live there. I am reminded about one of my own experiences about death, and I had to face death for the first time when I was 6-year-old. At that time, one of my uncles have died in an accident, and he is my mother's younger brother. So, at that time I had seen my grandmother and mother crying, but that really did not affect me much. But someone told me that they took him to a burial ground and cremated him. So, I started getting upset and wondering how he could bear the pain of being burnt. And for a long time after that, I was not worried really about my dying, but I was thinking, after death, how am I going to bear the pain of being burnt? So, such silly questions will be asked by the children. And apart from that, they might also ask, why did not God do something to help, or why did God do this? Now, that is a tricky question for the parents, and they have to answer according to the religious background, because Christians and Muslims have different perception about death and after death when compared with the Buddhists or Hindus. So, basing on their religious background, the parent has to give them answer to this question, and they should not, as is usually done by many of the parents, they should not say that God took that person because that person is very good, so he took him with him. So, the child might get a fear that if the child is very good, then God might take him and he or she also might die. So, parents should avoid such answers, and they should try to explain such questions from their own religious background. Now, Elizabeth Ross, she has given a very good explanation, and she gave many details about how children will respond to the loss of a parent age by age in her book on children and death. Now, let us see this slide where she explains how, beginning with 0 to 6 months child, how the child will respond to death. She says that the child will display distress and loss by changing initially the sleeping and eating patterns, and in this infant stage, the infant will responding to the grief of others. Now, all of us know that at this young age, the infant is not capable to understand what is death, but however, because others around the infant are grieving, that has an impact on the child. And this stage, Ross recommends that constant and loving care has to be given to the infant, so that the infant can overcome the grief to whatever extent it affects it. Going on to the second stage, Ross explains for a 6 months to 2 year stage, they do not understand the permanence of the loss, and they will keep on asking for the missing parent. And they also become angry because that parent is not coming. And another behavior that these age group children who are in preschool or who are toddlers, in fact, they start clinging to the caregivers, and they will not allow the caregiver to move out or go out of their sight, because they might fear that this caregiver also might never return back. And Ross recommends that constant loving care is a key to help them come out of the grief. Elizabeth Ross explains how 3 to 5 year old responds to the death of a parent. She says they keep on asking questions concerning the absence of the parent, and their anger is intensified here. They also show anger, but it is an intenser level because the parent is not coming back. And here they also engage in lot of magical thinking, and they have many fantasizing thoughts about that burial ground, cemetery, and also about the process of dying and death. And one more typical behavior that is observed in this age group of preschoolers is they try to cling to their toys. And another important thing is it is very important to keep talking to the child about the loss. That is the recommendation given by Elizabeth Ross to help them overcome grief, because in this age group to 3 to 5 years, although children are not clear, but still they are expressive enough to communicate their fears and emotions about the loss. Going on to the age 5 to 9 years, here in this age group, grieving manifests in many different areas. For example, their school performance is hampered, and their social relationships also get hampered. That is, they stop mixing and mingling with other children, they stop going out to play, and also other aspects of behavior can also be seen, like they become highly irritable, they have mood swings, and also just like in the earlier ages, they also will have anger reactions. Apart from that, Ross identifies that it is at this age, children need to be given solid answers for the questions that they have about death and the process of dying. And also at about the age of 9, they start to have abstract thinking, and they get to understand that death is irreversible, and then helping them to come out of this grief. She recommends that lot of care and attention needs to be given, and a supportive mechanism has to be put in place so that the child's normal functioning is not affected. For example, there should be some guardian or someone else taking care of the daily needs of the children, so that their normal life is not hampered so much. So that will help them to overcome the grief to some extent. A child is considered to be terminally ill when the disease that he or she is suffering from is incurable and which will eventually lead to death. The reaction for terminal illness varies from individuals to individuals, and the usual question asked by the terminally ill patient and the family of the terminally ill patient is, how long are they going to live? Which is a very difficult answer. But however, the dying trajectories can help to some extent to make them understand how the disease will progress, and also the probable period of the end. Now, a terminally ill child, for the child cannot understand that the concept of death, and for the parents also it is highly traumatizing, because they might have never imagined that their child will die before them, because usually what we tend to perceive is that we can perceive the death of our parents, but we seldom think that there will be a likelihood that the children will die before the parents. So, there are several stages in which the terminally child will progress. That is, in the initial stage, the child will start observing that frequently he or she is being taken to the doctor, and then the child will start observing that he or she is being hooked on to several sophisticated machines, and also is given lot of medication. So, the child will gradually come to realize that he or she is spending lot of time in the hospital, and also lesser time at home, lesser time with the siblings, lesser time with the friends, and also the parents are not really sending him or her to school. So, all these events that happen in the life of a terminally ill child make the child realize that something might be wrong with him or her. And as the disease condition progresses, frequently the child is hospitalized, and the child starts to stay in the hospital for longer and longer periods of time. And another factor is the child is usually placed in the children's ward along with other terminally ill children. So, the child gets to see that the child, one of the children in the ward has died, and then it hits this terminally ill child that probably this child is also going to die. So, in these various stages, slowly the child will get to understand that something is initially wrong with him or her, and that in the second stage they start understanding that something is seriously wrong with him or her, and in the final stage they slowly get to understand, yes, they might be dying. Now, let us see what are the reactions of the terminally child are. First, the child will go through the stage of fear and anxiety, fear of impending death, fear of the medical procedures, because the child, so many needles will be inserted in the child, and the child might have to undergo several operations. So, the fear of the medical procedures itself add up to the grief or the fear of the dying child. And apart from that, they have anxiety because they get separated from parents, they do not spend much time at home, and parents also, they will not be able to spend more time with the child. So, there is this fear and anxiety as a reaction to terminal illness. And after that, the child also will get angry because of loss of self control and independence, and also angry at all the healthcare professionals because the child's freedom is restricted, and the parents also will forbid the child to eat things that the child enjoys, and also play games that the child really enjoys. So many restrictions will be suddenly placed on the child, and all this makes the child angry, and the child cannot understand why he cannot play as he used to play earlier. And also the child will be hooked on to all the machinery. So, the child also gets angry because of all these discomforts that the child has to face. Apart from that, child also has lots of sadness, especially towards the last stages when the child get to realize that he or she is going to die. So, the child will feel sad because of leaving, the probability of leaving the parents and going God knows where, because their concept of death is also not clear enough, and they do not have clarity about what happens after death. So, there is lot of sadness on the part of the terminally ill child. Apart from this child also will feel lonely and isolated. especially those children who have to spend lot of time in the hospital setting, and there will be only limited visiting hours in hospitals. And if the child is placed in the ICU unit, very few members come to visit. So, this all leads to loneliness on the part of the child, and the child also will feel isolated. Many of these terminally ill children develop a fear that they might be neglected and they might be given up by the parents. So, they put on a brave face that everything is fine with them, and they also try to be as less fuzzy as possible in some of the cases. And some children fear that their parents and others whom they know will forget once they die. And there is recently I have seen a video on the YouTube where the parents had prepared all the photos of their child who has died. It seems she has specifically asked them not to forget her after death. So, many children have this fear, and when these terminally ill children, working with these terminally ill children, one has to realize and understand all the different kinds of reactions that they have, so that proper intervention and proper support can be given to them. We cannot do anything to cure their condition, but most importantly we can do many things to make their stay as comfortable as possible. Elizabeth Ross says that if we give a chance to the child, spend some time with the child, making the child talk about his or her feelings, making the child talk about the fears that the child has, making the child talk about concept of death, is giving an opportunity for the child to live, and the least that the parents or the supporting members can do. Now, let us see what we can do to help the grieving child to cope with death and dying. There are many techniques that are suggested by psychologists, and some of them include expressive therapy. Since children are not so expressive, elders can encourage them to discuss more about death, so that they will come out with their inherent fears, and once their fears are expressed, then the parents can give them suitable answers and give them the correct information, so that their misunderstanding about the concept of death is removed. And apart from this, they can also do play therapy, because children love to play. And during the process of this play therapy, they will express their fears about grief. And also art therapy can be used, where to the mode of drawing or painting, the children will express their fears and their grief process. Apart from this, even grief groups can be arranged, where children suffering from some loss, all of them can be brought together, and each child shares their loss with other members in the group. And when this happens, the child will get to know that even many other children had suffered a loss, and that child is not singular in the loss. And when the child gets to hear to the what other children of his own age group is saying, then the child will get back the lost confidence, and the child will get reassured, and the child will also gradually develop that the concept of death, that it is irreversible and that it is a natural and normal process of life. With this, we will be concluding the discussion or the lectures on death and children.